Hi everyone, and welcome to today's Lunch and Learn. It's really great to see so many of you dialed into the call. I'm Ruth, I'm part of the Local Care Partnerships development team. If you are new to Local Care Partnerships and signed on using the Eventbrite link, Quemby, you're sharing the Teams call right now.
Sorry.
Thank you. If you're new to local care partnerships, what we do is we bring together different partners across different organisations in their local areas to talk and join up around health issues. So the lunch and learns we run are a way of bringing topics that impact across the city into one place. And today's session is looking at public health's data tools, where they've made health data about your area really easy to access, understand, and use. We've been using them ourselves in different LCPs to learn about the health needs of that area and decide what we want to work on. And in a second, I'm going to hand over to the team who can talk you through these tools in a bit more detail. For today, you should be able to see a Q&A button at the top of your screen, and you can ask questions in that Q&A section at any time. You just type them in, hit enter, and at the end, we'll have some time where we can pick out some of those questions and go through them. If we don't have time to get through all of them, we can type up responses and send them out with information after the session. This session's also being recorded and will be uploaded to our YouTube channel and distributed afterwards. So if you've got colleagues who could benefit from some of this information, or people who couldn't make it today, that's absolutely fine. There will be a copy available to people. So without further ado, I'm going to hand over to the public health team who's here today. So we've got Lauren, we've got John, and we've got Quenby, and they're going to talk you through the tools and how they can be used. So over to you guys. Let's bring you on screen.
Hi everybody, I'm John. I'm a public health officer for Leeds City Council, and welcome to the session. Thank you so much for joining us. So today we're going to be looking at 3 examples of public health data tools that may be useful in your work, and it really is a magic land of information and exploration, and it can help you understand an area or a community better. We'll start with a bit of context into why we use data and who can use it, and then we'll take you through the tools themselves and how to use them. We're going to look at the PCN, the Primary Care Network Infographics, ward profiles, and the interactive area health profiles, so you can see how they can help you in your work. Next slide, please. So data allows us to get a clear picture of geography and or a community that live in that area. It should inform us of the makeup of an area and what affects the people that live there, which is vitally important if we're to help them, support them. It also looks at not just needs, but what assets and opportunities, both human and physical, are available to residents. We look at different sizes of area, starting from ward level, which is electorate wards, then breaking the ward down to medium or middle super output areas, which can average 7,000 to 8,000 population, further down to sub-ward geography of lower super output areas, which average 1,000 to 3,000 people. The Armley ward, for example, is broken into 3 MSOAs and 15 LSOAs, and it just allows us to have a little bit of a closer, more granular look at what's going on in these areas. All of the UK is broken down as such. Across the city, in our 10% mostly private neighbourhoods, we are currently conducting a health needs and assets assessment. So not just what's wrong, but what's strong in an area. This is a detailed and comprehensive study of an area, and as well as standard epidemiology such as cancer rates, we consider social and commercial determinants of health such as employment, poverty, education, frequency of alcohol and fast food outlets, for example. It's also crucially gives examples of some of the assets in the area. Anyone considering working in an area should visit Leeds Observatory as a starting point. So I'm now going to hand over to Quemby to have a look at the PCN infographics.
Thank you. So my name's Quimby Harley. My pronouns are they, them. I work in the public health intelligence team within the council. I'm going to talk a little bit about the PCN infographics. So the idea behind these was kind of to give a very quick and easy way to sort of have a top level overview of a really broad range of indicators. And that was, as John kind of touched on, it's sort of bringing together healthcare, demographic, and what we tend to class as wider determinants of health, which covers a lot of different things around education, employment, deprivation. But yeah, the guiding sort of principle for the infographics was for them to be sort of easy to digest, easy to navigate, and non-technical. So something we're always very aware of in my team is we don't want to be creating things which make sense to us because we're analysts. We're trying to make things which can be used by a much broader, in this case, a professional audience, but not necessarily a technical audience. So yeah, it's primarily targeted at people working in primary care. Really important distinction. We wanted to make it as an informative tool, not a formal ranking or a performance framework, because that brings very different approach, and a different way in which it's used, and we just want it to be used to inform people about the issues affecting the different areas around Leeds. So this is an example of one of the PCN health profiles. In this case, Burmtofts, Hare Hills, Richmond Hill. So you can see it covers a lot of different areas. We use red-green text to indicate. So red is where a value is significantly worse than the Leeds average. When I say significantly, that's statistically significantly. So it just means we're confident that it is higher than the Leeds rate or lower than the Leeds rate, as the case may be. And then green showing where it's doing significantly better. So in this case, cervical cancer screening. That's actually wrong. Sorry. So the black text can either indicate there's a lack of statistical significance, there's an issue with the data, as is the case with the common mental health issues, which we believe has been underreported in some areas, or it can also indicate we don't want to make a qualitative judgment about it. So, for example, we don't want to make a qualitative judgment of a more ethnically diverse area that's not better or worse than the Leeds average. It's just different. So we don't want to bring that. We don't want to make that judgment. So it's built around the Core 20+5 framework, and then we add to that with loads of different indicators from Social Progress Index, Marmot City work, and specialist teams within the council. And we have more indicators than we can include on any one profile. So there's a bit of customization to pick the most relevant indicators for the different areas. So this is the second page. There's the first page of the adults, the children section. That was something we changed based on sort of the feedback we got, because the early versions was just sort of all of the indicators grouped together. And then we had some feedback saying actually it would be really good to separate out the children's data. So that's something we sort of took on board, and brought all of the children's health data into sort of one, like into the second page of it, basically. So as you've probably noticed, there's different colors for the different boxes, and also the icons. The only significance of those is they're designed to help navigate it more easily. So if I want to look at education, then I've got the mortarboard hat as a sort of fairly standard symbol of education, and I can very quickly see that and navigate to that, and see, okay, all of the boxes sort of connected together in purple are all relevant to that icon. So yeah, just trying to use that to make it as easy to navigate and as easy to find information as possible. And these are all designed with some accessibility-focused visualization standards, which were developed within the Public Health Intelligence team. There's a lot of different things which go into that. But a couple of the key things are using a consistent sort of 14-point text size for readability, and the color choices are specifically chosen to be compatible with some forms of colorblindness, because that's a fairly complex thing to work around, but there's been a lot of work that's gone into trying to make them as accessible as possible. I think I'm now handing over to Lauren.
Yeah, hi everyone, I'm Lauren. I work in public health in the localities and primary care team. And my pronoun's actually her. So we've had some really good feedback so far on the PCN infographics from partners across the system. And we really love that they make the data look so simple. So for people who aren't as familiar with using data or don't know how to find it, it's a really quick and easy way to kind of see that big picture overview of how things look for PCN. So in the local care partnerships, they've been brought to those meetings as a focal point for conversations around sort of priorities for the upcoming year. So that's already happened in West Leeds and Morley PCN, and it's going to be happening in Crossgates next week as well. So that's great. And they've helped us in our work with primary care colleagues. So one of the things that we've done recently is supporting on some vaccination work in the Bermondsey, Hare Hills and Richmond Hill PCN. And we've used the infographics to deliver some trainings front of house colleagues to help them understand like the local population of the PCN. So they understand a bit more about the people that they're interacting with and the barriers that they might be facing in accessing primary care and how that might be contributing to low uptake in some of the vaccinations. And ICB colleagues as well have been using them with primary care to sort of steer their priorities. And it's great because, as Quemby said, it's built around the core 20+5, so it's aligned to like a national NHS approach that's like embedded in primary care that supports wider like health inequalities work, which is great. And what's great about this is it's bringing information about wider determinants of health into primary care, which is traditionally built on a more like medical model of health. So it's thinking about it in a bit more of a sort of public health way. And from the engagement that we've had from partners, we've kind of had some ongoing development of the infographics themselves. And so as Quenby mentioned, with common mental health, that was one thing that we discussed quite a lot. that partners raised that they felt that it kind of was misleading when they were seeing green in a lot of the areas or PCNs where we might expect, where there's higher levels of deprivation and we might expect to see higher levels of mental health issues. They were often showing as green, but as Quimby said, this is often potentially because of underreporting in certain areas, so it might not reflect a true picture. So that's why we chose to remove the RAG rating for common mental health on the infographics. And I think we're going over to John. Quimby, can you move to the next slide? John, you're just on mute at the moment.
Sorry, everybody, schoolboy error. I'm back. The next tool we're going to look at award profiles, which is something else that we developed to delve into some data on a smaller footprint. On the screen is an old style award profile card, which Quimby and Lauren have turned into something beautiful, but this is how they started. I wanted to make an important point that Lauren and Quimby have raised, is that these are profile cards and they shouldn't be referred to as scorecards. They look at areas where we need to support a community. They're not there to rank a community or tell you where it is best to live. And as we all know, in some of the communities with the most challenges, people have been successfully raising families for years. So the reason for them is where primary care networks, local care partnerships, patient populations cover more than one ward, the social and wider determinants of health by each ward will vary and be very different in more affluent wards. So if you put all the statistics together, it can mask the true story. And Lauren's going to go into this in a little bit of more detail. So affluent wards can mask statistics when we're comparing them to poorer ones, and possibly we'll miss the areas where we need to add more support and help first. So it splits out beneath the PCN the wards we need to look at first, or we need to put most of our resources into. So I'm now going to hand over to Lauren, who's going to talk about PCN and ward boundaries.
Thank you. I'm going to attempt to take control of the presentation, Quimby, if I can. Thanks. So we're going to start off looking at, this is a map of West Leeds PCN. So what John just showed, that was West Leeds as well. So this is what the footprint of West Leeds PCN looks like. It's quite a big footprint. So for people that are sort of familiar with this part of the city, it stretches all the way from sort of parts of Bramley all the way over to kind of where Leeds and Bradford meet, and all the way up to kind of the edge of Eden. So it's quite a broad area. And then if we, sorry, should have left you in control, Quimby. If we have a look then at how the wards fit into that, you can see that we've sort of got 3 wards that fit within the West Leeds PCN. So we've got Carverley and Farsley, Bramley and Stanningley, and Pudsey. So wards themselves are different sizes and have different populations living within them. It's also important to note that they don't perfectly line up with the PCN boundary, so it makes things a little bit complicated, but we've tried to kind of focus on the wards that fall most within each PCN. So we have 19 PCNs across the city. Some PCNs have kind of more diversity than others, but we focused on the PCNs where we felt like there's kind of most diversity between the wards within that PCN. So at the moment, we've got 6 of these ward profiles. So we've got them for West Leeds, Central and North, Bramley, Wortley, Middleton. LSMP is Leeds Student Medical Practice and the Light, York Road and Woodsey and Holt Park. So they're still high level data, but they just break things down into those sort of smaller footprints of the wards. So similar to the PCN infographics, they've got a mixture of population data, so looking at deprivation and ethnic diversity, and then also health related data. So they don't have the full breadth of indicators that we use on the PCN infographics. Obviously, there's quite a lot to display on these because we're looking at multiple wards as well as the PCN. But they do use, there is sort of similarities from the PCN infographics. And again, we're using colours to show where rates are higher, similar to or lower than the Leeds average. And just, yeah, important to note that sort of depending where you work, what your role is, depends what footprint you might want to work on. So a lot of primary care colleagues will want to work on a PCN footprint. If you work in the local authority, wards might be a bit more relevant to you. So just something to think about. So this is an example. We're starting off with West Leeds PCN. So you can see that we've got a column which shows West Leeds PCN, so that's the data for the whole PCN, and then you've got the 3 wards to the right of that column, breaking it down. And we can see here the kind of difference between the wards. So we've got quite a lot of red in Bramley and Stanningley ward. So that's indicating where rates of health conditions are higher than the Leeds average. So almost all of them are red for that ward. And then moving across into Pudsey, you've got almost all ambers. So that's where rates are not significantly different to the Leeds average. And then in Carverley and Farsley, you've got a sort of a mixture of a few, but you've got a few greens in there, a few ambers, and just the one red. So you can start to see how things differ when we break the data down onto smaller footprints. And also that when we look at the deprivation data, so looking at the percentage of the population that fall within IMD1 and IMD2, so that's the sort of most deprived neighbourhoods nationally, there's a bit of a correlation between the proportion of the population in those IMD areas and the kind of higher rates of health conditions. So we'll look at one more example. So this is for Central and North PCN. It's just a really good example to show you how it's really stark in some of the PCNs that actually looking at the whole of Central and North PCN, we've got a full house of greens, so everything's looking great. We've got lower rates of all health conditions. But when we start to look at wards that fall within Central and North, in Little London, that is Little London and Woodhouse ward, sorry, that is a real pocket where we've got like significant levels of sort of where we might want to put some more support in place. So we've got reds for almost all of those health conditions for Little London, as well as some ambers in Roundhay. So it just displays how things change between footprints. And back to you, Quemby.
Thank you. So I'm just going to talk through the interactive area profiles, which is another tool that has been developed by Public Health Intelligence. So this is a Power BI dashboard which gathers together a lot of the health and demographic data that we've sort of already seen in various forms. The key difference here is this is an interactive tool. So it has a lot of scope for people to change the parameters, change the geography you're looking at, change the age bands or the year of the data that you're looking at, and really explore the data on your own terms. Because with all of the things we've shown so far, it's sort of there's work that goes on in the background preparing the figure, but it's sort of for the consumer of that, it's sort of quite just sort of set in stone. This is the rate, and you just sort of have to use that and interpret that. But the reality is, data is much more complex. It's much more. There's a lot of work which goes on in the background in my team to get to that figure, and the interactive profiles give you an opportunity to explore that and dig into that and be like, okay, so that's the case for this. What if we look at a different age band? Or, well, as Laura was showing, it's like, okay, so that's the case for the PCNs, but what if we look at the wards within the PCNs? Is that going to give us a different picture? There's a real challenge with that between balancing the functionality and the usability. So we're trying to give people the tools to explore the data without making it overly complicated, without making it you need a lot of sort of technical expertise to navigate it. It is fundamentally more work, it's more effort to explore and understand the data when you have the opportunity to sort of interact with it more. It does require some more for a slightly higher level of technical ability. We really try and find a middle ground where we're not requiring too much, but it's a definite trade-off. And there's also a trade-off in terms of there's so much data we could display in so many different ways. But if you end up with a 200-page report, then that's not actually making it more accessible, because it's then very hard to navigate and find the data that you're looking for. So that's just a constant sort of struggle we're trying to find a balance with within our team. As with the PCN Infographics, we have a robust set of visualization standards. Visualization standards were actually developed for Power BI originally, and sort of the infographics are piggybacking off some of that work. So yeah, key things are the accessible color palettes, consistent layouts, good sized readable text, and there's also the option, I think, to switch to table view for screen reader compatibility. So it's trying to make it accessible in terms of the visualization standards, as well as like the level of technical ability needed to engage with it. Crucially, it's not a replacement for in-depth analysis by itself. It could be a really useful tool to identify areas for sort of more research and for more work. But there is no replacement for having people who really understand the data and can sort of bring together a lot of expertise, can bring in additional data to thoroughly sort of research more complex questions. So it's not replacing that, and I'm not just saying that because I quite like my job. So this is the sort of front page of the area profile. As you can see, there's lots of different ways. There's lots of different sort of pages. Each of these is a link that you can sort of follow to a different page where you can sort of explore different kinds of data in different kinds of ways. I'll be doing a little bit of a demo in a moment, so I'll sort of show you how some of that works. But yeah, this is just to give a bit of an idea of the breadth of data and the different ways it can be engaged with, and also giving you a bit of an understanding of the challenge we face with trying to keep the data that we sort of share navigable, because there is a lot more we could add into this to explore the data in different ways, but it's that trade-off between what we can do and what is useful for us to do in terms of the user experience. This is a pretty common sort of layout. So this is showing peer comparison. So in this case, it's PCN footprints, asthma, April 2023 data, and similar to the PCN infographics or the ward profiles, it's sort of showing statistical significance or sort of different rates in different areas. We also have a little visual of how that's changed over time within Leeds. So yeah, that's a pretty common thing for comparing the case in different PCNs or different wards or different MSOAs. So yeah, that's just one sort of style of page you can get. Another one is you can look at the comparison of a chosen area against Leeds and against deprived Leeds. So in this case, we're looking at the hypertension rate in Gibson and Hare Hills. Just briefly, the banding around the rate, in case anyone's not come across that before, that's showing the confidence intervals. So that's the range we're 95% sure the figure is in. So we see overlapping between those, it's showing that we're not confident, but there's a real difference between the rate in the two areas. But yeah, so the idea of this is just we can compare the trends in an area we're looking at with the trends in Leeds or in deprived Leeds, and that gives us an idea of, okay, is this typical behaviour for the city as a whole, or is something strange going on in this area? And that might mean, if we're seeing the rate is dropping very rapidly in one area where it's not dropping very rapidly in Leeds as a whole, that might tell us, okay, maybe there's an intervention in that area which is being really successful, which we should look to duplicate. Or maybe there's sort of some big changes in the population demographics or whatever. So yeah, it just gives us a bit of context to understand, is this a particular, is this change of particular interest in this area, or is this sort of fairly consistent with what's going on in Leeds as a whole? And that affects what level you might look at, like having interventions. So yeah, it's very interesting to me when you get into this more granular detail, because that can tell you a lot about what's going on in Leeds versus what's going on in the specific areas, and that can tell you a lot about how you want to be targeting your interventions. And then there's also mapping. The box with the data written out is sort of comes up when you hover your mouse over an area. So this is just a screenshot, but in the actual interactive map, you can hover your mouse over, the Harewood MSOA or whatever, and it will say, then it will give you the rate and it'll give you that more in-depth thing. But this is just a basic heat mapping showing, just visually showing where you are seeing high rates of, in this case, causes of death. So you can see where there's the darker green in the city centre, or sort of the more central area, we're seeing higher levels of death from preventable causes. So yeah, that's just a way of looking at it geographically. I'm going to see if I can do a demo now. So bear with me in case this goes horribly wrong. Can everyone, people, yes, I can, that is visible. So this is the live area profile. This is accessible from Leeds Observatory, I believe. It's publicly available. Yeah, because of there's a lot going on in the background, it can be a little bit slow to load, so you need to have a little bit of patience. But yeah, so this is the front page, which I was talking about. Let's say I want to look at common mental health issues, how that's changed over time. So that's where these slices come in. So you can go and you can scroll through and you can select any one of these issues. So I'm going to look at common mental health issues, geography types currently on community committee. Let's say I want to have a look at PCN footprint, and then I can go through and select. Let's have a look at Armley. Gender is currently set as female. I'm going to have a look at male actually and see if that's a different picture. And all of that together, and then I can select. I want to see the confidence intervals, or I don't. That's more personal preference than anything. Yeah, and then that gives me this chart, which has this. It has this sort of adaptive chart title, so it sort of neatly summarizes its age standardized rates of common mental health issues in Armley PCN compared with Leeds and deprived Leeds, looking at male, all ages, Leeds GP registered populations. So it's just very clear labeling, which sort of is interactive and changes as you change the slicers, which is these little boxes on the side are called. Yeah, and that's showing me, okay, that's quite closely related. The Armley rate is higher than the Leeds rate, but it's not. It's sometimes statistically significant, sometimes it's not, but it seems to be mapping the trend. It seems to be matching the trend quite closely. So it's maybe a little bit higher, but it's mostly consistent with the Leeds rate. And then I can say, okay, well, I wonder what the severe mental illness rate looks like. Oh, that's a different picture. So that's significantly higher in Leeds. It's more variable in Armley, the severe mental illness rate amongst men is significantly higher than it is in Leeds. It seems to be a bit more variable, which you might expect because it's a smaller population, which means that you generally have a bit more variability in results. Okay, so that's a bit of a different picture. So that gives me some more information about common mental health issues is tracking very closely the Leeds rate, but severe mental illness is showing a higher rate. So that's a little bit of a difference. And then I can go back and say, okay, so let's have a look at the same sort of data with regards to like the comparisons between areas. So let's look at common mental health issues, male, latest data. So that's April 2023, and yeah, I want to compare to Leeds. And then I can see how that varies across all of the different PCNs, and see how that sort of varies between different areas. I can do so much. You can do so much with that, and there's almost endless sort of combinations and sort of ways you can explore that data. In the interest of time, I'm not going to go into any further detail, but just giving you a little bit of an idea of sort of how that interactivity can be so useful. So some key takeaways we want you to sort of take away. So the different tools are going to give you different levels of insight. They're useful for different purposes. So you can think about what you need, and obviously you can always ask us, or you can ask people in your own data teams what might be the best tool to look at this particular question. Also, we're looking at quantitative data here because that is sort of the easiest to sort of compare between areas. It's only one part of the picture. There can be a danger of if you only look at quantitative data, then you can miss part of what's going on, and by its nature, you end up prioritizing what is easy to measure, which isn't always the same as what's important to measure. So it's only part of the picture. You want to perhaps be using qualitative data and sort of intelligence from on the ground to sort of supplement it and build a more robust picture. And often in my team, the quantitative data will help us identify something's going on here, and then it turns to when we have to turn to qualitative information and sort of reports from services working in that area to actually understand the problem we're understand what's actually going on. Not all data can be taken at face value. We mostly use sort of GP registered populations, which is a pretty robust set of data, but it's not perfect. So there's some people who are less likely to be recorded. Gypsy Roma traveller people, for example, are less likely to be registered with a GP. So that ends up being a little bit of a blind spot for our data. And that as we're talking about with common mental health issues, sometimes there's differences in sort of how widely it's reported. So there's always factors which affect how reliable the data is, which you need to bear in mind when using it. And you need to be a little bit critical when using it. That being said, don't be scared of data. There's sometimes this idea that you have to be sort of a maths genius or a professional analyst to be able to understand data at all. It's really not the case. Data should be part of a lot of different people's work, and don't be scared to explore it. The worst that's going to happen is you're going to get confused. It's not the end of the world. You're not going to break anything. And if you do get stuck on something, then ask. There's people like me who are weird data nerds whose job it is to understand this stuff. So if you get confused or if you want some support, then yeah, please do ask, because so much good can come from collaboration when it comes to data.
So there's loads of data out there. So if we've got you interested and you want to find out more, I'm going to highlight the other places where you can find data. So this is a screenshot from the last page of the interactive Power BI tool that Quenby's just talked us through. And that signposts you out to different bits of data, some dashboards that have been produced by Quenby and their team. So there's the demographics, and there's 2 demographics dashboards, and then it also takes you out to some external data like Office for National Statistics. Quenby, could you go to the next slide, please? I've lost control. Thank you. John mentioned the health needs and assets assessment. So those are on the observatory, and I think Ruth has posted the link in the chat. And there are more coming. So the team are really busy at the moment writing these assessments for lots of different areas. So we've got Gipton, and that's split into Gipton North and Gipton South and Killingbeck Park. We've got Hare Hills, Bermondshaus and Richmond Hill, Armley, Beeston Hill and Holbeck. So all of those will be coming, and I'm sure they can be shared through the LCPs. There is the Social Progress Index, which you might not have heard about, but that is a tool that helps measure how well Leeds is doing in terms of inclusive growth. So it kind of helps us understand what's happening in different areas of the city. So this is ward based. It uses ward footprints, and it looks at different parts and kind of offers an unbiased measure of overall well-being in the city, and that measure is made up of 3 broad themes, which is basic human need, foundations of well-being, and opportunity. So every ward is then given a measure and ranked, so you can have a look at that. And there is also fingertips, which is a huge, there's loads on there, so it's publicly accessible data, and it's a bit of a one-stop shop for collating data from all over the place. So feel free to have a little look at all of those. The PCN infographics and the interactive area profiles are all available on the observatory, and I think, again, that's in the chat, and we are aiming to publish the ward profiles in the same place very shortly, so you can access all of those there, but we'll make sure the ward profiles maybe get sent out with the slides, just in case it's a bit slow getting them on the observatory. And I think that's all from us. So we've got 15 minutes for questions, and I think Ruth is going to come and join us.
Yeah, I am. Amazing. Yeah, Quenby, feel free to stop sharing your screen so people can see our lovely faces in full view. That was amazing. It's just great how accessible this data is, and how we've got those different levels from the PCN infographics, where it's designed to be at a glance, and then for data nerds like me, you've got that interactive tool where we can really mine deep. And what's been great today is all of the comments in the Q&A. People are really engaged with this, so people getting really excited about it. So it's been wonderful. Thank you all. Big questions that's been coming up have been around accessing these tools, which Lauren, you've talked about. So we'll make sure we send out all the links afterwards. So that'll all happen. Then I've been responding to what I can whilst we've been going, but there's a few questions I want to pick out for discussion. So Nadia Anderson asks, is there an opportunity for clinical directors to be involved with what data is presented in the infographics? So that's the first tool we looked at. So yeah, if any of you want to come in on that.
I can answer. Hi, Nadia. Yeah, I mean, obviously we're really keen to keep involving colleagues across the system. So I think the Health Inequalities Action Learning Group that you attend is probably one of the central places that we'll consult. The aim is that we'd kind of update these annually, so they'll probably stay as they are for this year. Excuse me, frog in my throat. However, when we come to update them, then we'll come back out through Health Inequalities groups, through the PCNs, and through the LCPs to see if there are things that we think are missing. But Nadia, if there's something in particular that you wanted to suggest, feel free to drop me an email.
Thanks, Lauren. Around the readability of the infographics, it's great to hear that you looked into colour blindness and that sort of thing. Suggestion here from Catherine about adding arrows, like an up and down, as well as the red and the green colours as a potential accessibility. Quenby, I don't know if you want to come in on that one.
Yeah, it's a good idea actually. My only concern would be quite often we end up using arrows as a sign of this is increasing or this is decreasing. So like indicating change over time. So yeah, it's not. I suppose we could include a note about how we're using it, but also it's you don't want to be working against people's like initial impressions. So if people are, we don't want people to assume that this is that the arrows show that this is improving or getting worse in an area when that might not be the case. So yeah, it's a good idea to have some kind of visual thing. It might not be the right thing for that exactly, but possibly like a possibly like a thumbs up or thumbs down, even just as like a very simple thing. Maybe not that, but like some kind of visual indicator which can't be confused for showing a trend would be more appropriate. But I really appreciate that feedback. That is a really good, and like with the red and green, those specific tones are designed to be understandable for people with some forms of color blindness, but obviously it's not going to work for everyone. So I think that is a really good point, but I'll sort of consider when we do the next update.
Awesome. Thanks, Quemby. Yeah, accessibility is really important. So it's always good to hear where that could be improved or what things haven't been considered. So thanks, Catherine, for that. The next couple I'm going to just group together because it's around the data set. So when we're looking at the PCN infographics and the ward profiles, what is the time period are we looking at? And then also what region, how is that comparison? So what region is being compared to Leeds? Is it nationwide stats? So if you could talk to those two things.
So we're not comparing the Leeds stats to anything. So we're comparing the PCN areas to the Leeds stats in the PCN infographics. So yeah, that's what the comparison is. So we're just saying this area has got a significantly higher rate of common mental health issues than Leeds does. So we're not making a comparison to the regional or national rates for this. In terms of what period it's from, that's messy, is the honest thing. We use the most up-to-date data we have available when we publish, but that varies depending on what the indicator is. So a lot of demographic information comes from the ONS mid-year population estimates, which are published with a bit of a lag. Similar with a lot of the mortality rates, they're published with a bit of a lag, whereas some things are, we can have sort of almost sort of like live data. So we can run audits which sort of extract the information for the end of the quarter. So if it's the 5th of April, then we can have data up to the end of March. So it sort of varies depending on the data, just because of the nature of the infographics. We don't really have space for all that metadata. So that is a little bit of a shortcoming. I will say that the idea is, again, these are sort of a very quick overview, and like if you need that more in-depth information, then that's where sort of the area profiles are might be better suited, and that has the not only the actual information about when the data is from, but also you can change the period of data you're looking at. So
yeah, that interactive profile, you can control for those things a little better. Yeah. Cool. There are so many questions coming in, so I'm aware we're not going to come to all of them. So we'll try and respond to them in an email after with all the slides. So apologies if we don't get to your question. We have a question here. Some of the stats have very little percentage difference, but were ragged red versus green. This makes a difference to typical funding. Is there any data regarding the impact of spend in wards to the change intended? I wonder if there is data like that exists, or whether, John, you can talk about impact and when you're looking at these data profiles?
Yeah, very briefly, because I'm conscious of time, but you can contact me if you want a more in-depth chat. I'm happy to help. So a good example would be Better Together, which is a Leeds City Council Public Health Commission service. So those ward cards determine, and typically 10% most deprived, determine where we focus our activities. And those activities are monitored through Leeds City Council commissioning unit and the quarterly monitoring. So we can see how many people are reached and how many communities are reached. And the idea is that we do all of the LSOAs that are 10% most deprived in the life of the contract, which could be 5 years. So the Better Together service, it's an outreach service, it's reconnecting and connecting people to their communities and to primary care, should cover all of those LSOAs in the west and in the east and in the south. And then just very quickly, there are individual evaluations to very specific projects, such as health checks, ESOL classes, where we're trying to get people to have sufficient English where they can access primary care. So that those do exist. But the ward cards are a fairly new phenomenon, and it's because some of the PCNs, as Quenby and Lauren have pointed out, cover multiple wards. Don't know if that was any answer at all, but you can contact me directly if you want a longer chat and you want to ask more questions. Please feel free.
Awesome. Thanks, John. It's really complicated, isn't it? Because you pick a certain indicator, design intervention, measure against that indicator, and then there's all these other lessons that you can learn from it as well. So evaluations is probably where you'd need to look. I think most of the other questions. Oh, Lauren, yep, you come in.
Sorry, I'm raising my hand. I wasn't sure what the etiquette was. Just thought I'd highlight it because it was in the Q&A. Somebody asked about looking at a map of the PCNs and things like that. So I'm just going to really quickly show this map. I put a link in the chat, but there is this map that exists, which hopefully you can see.
Yes.
So on here, you can see different footprints. So at the moment, I've got it. I've got PCN boundaries showing. So these are all the PCNs, and you can see like they're all different sizes. You can on here where it says you want to be on this box. You can look at Leeds wards. So those are the wards across the city. You can look at PCNs and wards all in one, although it's quite difficult sometimes to figure out what you're looking at. And then you've also got the LCP boundaries. So that might help you when you're thinking about where you are and what you want to look at and what you're trying to find. There's also the MSOAs, which are those even smaller areas. They're codes, so it might not make a lot of sense, but if it's useful, you can have a look at that map.
So I think what we've done is what happens every time I find when we share data tools is you give people a taste, and people want more data. A lot of these questions is, where can I find data for this? Where can I find data for this? West Yorkshire and lots of other things. So we'll try and answer those as best we can and send the information out. I don't know about all of you, but I can lose hours to data. And I think what Quenby said at the end was really important. It's about marrying that up to what you're seeing on the ground and putting that into practice. But yeah, amazing tools. Thank you all. We're going to wrap up there. We'll send out the slides, the links to the tools. We'll try and answer the additional questions and the recording afterwards. We'll also send a link to a feedback form, but I'm going to share the QR code to the feedback form in case you want to fill it out right now. And that's all for us today. Thank you all and have a wonderful rest of your day.
Thank you.
Thank you.
Bye.